Hello everyone, welcome in my Physio channel. Today we are going to discuss about the stretching of calf muscle and how to do and its techniques. Let's first talk about anatomy. It has two muscles. That means calf muscle has two muscle, that is gastrocnemius and soleus. The gastrocnemius muscle is a part of the superficial flexors of the leg. The gastrocnemius muscle arises from the femur and it crosses the two joints, the knee and the ankle. So we can say the gastrocnemius has two joint muscle. The gastrocnemius muscle has two heads, a medial and lateral head. So the origin is medial head, which arises from the medial condyle of the femur, and lateral head from the lateral condyle of femur. Insertion at the Achilles tendon of ankle. And action is plantar flexion of foot, that is a downward movement of ankle. The nerve supply, that is tibial nerve. The soleus muscle originates from the shaft of tibia and fibula. Insertion at Achilles tendon of ankle, nerve, that is tibial nerve, and function is plantar flexion of the foot. In this diagram, the posterior view and the lateral view of the leg is present. Here the gastrocnemius muscle, two heads, lateral and medial, the soleus muscle and the Achilles tendon of ankle. Here the movement, that is plantar flexion, downward movement of ankle. Here it is a lateral view and it is a posterior view. Pain. So what to do now? So the light stretching of calf muscle which help to ease your calf pain. So ask a patient to hold each stretching for 20 to 30 seconds and repeat it 3 times. Self-stretching of calf muscle increase the ankle dorsiflexion movement. Let's see some techniques. So if you want only soleus muscle stretching in calf, so you have to perform ankle dorsiflexion with knee slightly flex. In this diagram, patient is do a self-stretching of their soleus muscle. So patient into a standing position with the wall support, knee is slightly flex and patient do ankle dorsiflexion, which stretch patient's soleus muscle. Here it is another technique in the prone lying and therapists perform a stretching of calf muscle. So in prone lying, patient knee is completely bent and therapists do a ankle dorsiflexion which stretch our calf muscle. If you want stretching of only gastrocnemius muscle, so you have to perform dorsiflexion with knee fully extended. In first diagram, the gastrocnemius muscle stretching is present. So patient is in the standing position. Patient do self-stretching with the wall support. Knee is extended completely and patient perform ankle dorsiflexion that stretch our gastrocnemius muscle. The another techniques in the supine lying of the gastrocnemius stretching. Patient into the supine, so the patient body is relaxed completely. Then therapist perform a ankle dorsiflexion with knee extension. Another technique of self stretching into a chair, with the help of chair, patient in sitting position and with the hand support, patient do a ankle dorsiflexion. The another technique with the chair support in standing position, patient do a dorsiflexion of the ankle. That is a sitting technique the patient can do with the help of towel or bend itself and which stretch your gastrocnemius and soleus muscle. If you want soleus muscle, so you have to put knee slightly in flexion position, and if you want gastrocnemius muscle stretching, your knee is completely extended and perform a ankle dorsiflexion. Here the another technique into a standing position, then sitting we can see is here the muscle is present, the gastrocnemius, the flexor hallucis longus, the plantaris. These all muscles are the posterior compartment of leg muscles. The tibialis posterior also. But the peroneus longus and peroneus brevis, these two muscles are the lateral compartment of the leg muscles. Here our Achilles tendon is present. The another technique for the hams and calf both stretching simultaneously. So patient is in the standing position with the wall support. Keep both feet flat on the floor and your back knee is straight, and gently stretch your leg so that stretch your hams and calf muscles together. Thank you. Keep learning.